We'll have a video because unfortunately Christian Jorgensen couldn't be present in flesh today. So we sent a video to talk about next generation of cell therapies for osteoarticular diseases.
For cure in Montpellier, and I will take the few minutes that we have to have an update on mesenchymal stem cell therapy. So a cell therapy dedicated to osteoarticular pathology. So first, very briefly, what is the unmet medical need? As you know, there are an increasing numbers of patients in Europe and in the US with osteoarthritis and vertebral discopathy and degenerative articular disease. And today, there are some options, including options in orthobiology, using PRP, using a combination of hyaluronic acid and PRP and others. And we also have the option to develop cell therapy. Can be a chondrocyte-based therapy or stem cell-based therapy. And there have been, in the past years, a lot of initiative and clinical trials, and I will share with you some of them. Just to know that in Korea, one of these products has been approved for osteoarthritis. And in Europe, Alofisel has been approved, but in fistula, in gastrointestinal pathology. And so very, very briefly, mesenchymal cells are interesting because they can differentiate to tissue that are supporting tissue, including bone, cartilage, muscle, fat tissue. But they also have paracrine activities, and they release EVs, but also cytokine factors, and globally they reduce inflammation. And so when we want to translate that in the clinic, as we have done in some of the program, the first question is, should we go to an autologous process or to an allogenic process? The first initiative was using autologous cells, because then you can re-administer the cells. There is no problem with safety. But one of the problems is the cost, because that means that you have to, for each batch of cell production, you have to have all the quality controls. And so this is increasing a lot the cost and the disponibility. And of course, an allogenic cell program, when you have cell banking, and then you have access immediately for the physician or the orthopedist to the cell product, that makes things much easier. So very, very briefly, we have to organize either the bone marrow or the fat tissue aspiration, and then you go to a GMP facility, you expand the cells, and you can cryopreserve the cells, and when you need, you have access to the cell product. You have a control of viability, you have a control of cell quality on the phenotype, and also on functional assays, and then it comes to the physician room, and you can be injected. So one example is osteoarthritis, a knee joint osteoarthritis. So you have local injection, and what you can see is you have some improvement in terms of pain. You have some improvement in terms of function. That's the Kuss analysis. But it is a modest improvement, and other and recent papers have shown that you have some improvement, but it is limited when you look at 12 months. It's limited. It's an improvement between 20 and 30%. So there are some limitations. And another very good indication is the intervertebral disc. And so as you see here, you have a decrease in the proteoglycan content and the hydric content, and you can inject using scanography with the needle. You can inject directly 20 million cells in the disc, and when you do that, you are improving lumbar pain for the patient, which is something important. And you can see here, and we can also see that we are improving the hydric content in the disc. When you do MRI at months 12, months 24, we have some improvement in the imaging. But however, there's clearly a need to improve the biological effect of these cell products. And one of the way to improve is to impact the genetic program of the cells, and we can do that with inhibitors of PPAR gamma. So this is one example how you can do that. You can, when you do that, improve not only the immunosuppressive effect, but also in vivo, and you are improving the potential of this cell product. Another way is to use vesicles that are expressed by the mesenchymal cells. So you have a mesenchymal cell lines in your bioreactor, and you can obtain all the extracellular vesicle that you can centrifuge, purify, and you can use this as a biological product. But it is not a cell product, it's very safe. You don't have any DNA. And so this is a way to improve. And at last, you can also obtain skeletal progenitors derived from iPS cells with a clearly improved of the cell product to obtain a new cartilage that can be formed, implemented in some in vivo models of cartilage defects. And with this, clearly obtain a fetal cartilage. But now there's some step to prove that this is functional, that this is biomechanical relevant for adult tissue. So this is an area where the unmet need is very important. There's a market access very important here for developing a cell therapy program. MSCs seems very safe, but the improvement is today modest, but clearly we are improving with the next generation of cells, genetically modified, or using EVs produced, or using MSCs derived from iPS. So there's a lot a new product coming on actually in development in early phase trials. And so with this, if you have any questions, I am absolutely available to reply. You can contact me by mail. That is here on the screen. And again, I apologize not being with you today, but I think you have a very good meeting, and let me know if you have any questions. Thank you very much for your attention.